Transplantation and donation. Transplantation is a medical procedure involving the transfer of organs or tissues from a donor to a recipient. The donor is the organism from which organs or tissues are taken, while the recipient is the one who receives them. Transplantation can be either clinical or experimental, with the latter necessary for studying immune responses and developing new drugs to ensure the successful adaptation of transplanted organs. Types of transplantation. Autotransplantation, the recipient serves as their own donor, e.g., skin grafts. Isotransplantation, the donor is an identical twin of the recipient. Allotransplantation, the donor is a genetically different person. Xenotransplantation, transplantation of organs from animals of different species. Donation. Donation can be either living or posthumous. Living donation, donors can donate a kidney, part of the liver, or hematopoietic stem cells. Posthumous donation includes the transplantation of organs such as the heart, lungs, and liver. Currently, access to posthumous donation is limited. Only about 20% of the population agrees to it, while in countries with advanced donation systems, this figure is much higher, e.g., 90% in the USA. Rules and procedures. According to Ukrainian legislation, any adult citizen can consent to posthumous donation. To do this, they must write a statement and submit it to a transplantation center. Consent can be revoked at any time. If there is no statement, the decision about donation may be made by relatives. Modern achievements. Despite challenges associated with the war in Ukraine, transplant operations continue. In 2022, more than 180 organ and tissue transplants were performed. The country's transplantation system has been safeguarded through legislation and the creation of a unified state information system for transplantation. The highest percentage of population readiness to become donors is observed in the following countries. Spain, about 80% of the population supports the idea of donation. Sweden, approximately 90% of citizens are willing to become donors. Australia, around 70% of the population expresses consent to donation. Norway, more than 80% of the population is ready to donate. These statistics demonstrate a high level of awareness and help ensure sufficient supplies of blood and organs for medical needs. Bioresonance in transplantology. Bioresonance therapy is becoming a promising approach to support the rehabilitation of patients after organ and tissue transplantation. This method is based on the use of electromagnetic waves to normalize the body's functions and improve the adaptation processes of transplanted organs. The application of bioresonance can reduce inflammatory processes, decrease the risk of transplant rejection, strengthen the immune system, shorten the recovery period after surgery. Research indicates that bioresonance therapy can complement standard treatment methods, especially for patients with a higher risk of complications. Conclusion. Transplantation and donation are vital aspects of medicine that save lives. Raising awareness about the importance of donation, improving legislative initiatives, and introducing innovative methods like bioresonance can significantly enhance transplantation outcomes and improve patients' quality of life.